All right, we are recording. Hello, everybody. My name is Maddie Fowler. I use they, she pronouns. I'm a neurodivergent and queer, and I'm here with Spark. I'll let them introduce themselves.
Hi, I'm Spark. I use they, them pronouns. I am autistic and queer, and I have been a disability advocate for over 10 years.
Awesome. And today we're going to be talking about overlapping identities of autism and queerness. So, just a disclaimer before we start, the opinions and statements shared in this presentation come from autistic people, scientific research articles, autistic experiences from blogs, websites, social media, and other sources, but they do not necessarily represent all autistic people because it's impossible to communicate with all autistic people all at once. And with our time limits, we're not going to be able to cover all of the important aspects of this topic, although we will be talking about a huge amount of information. But with this in mind, please remember to ask and do your own research and not assume. We'll also have some additional resources at the end to address some of the things that we did not get to today. So our agenda for today is our introduction, talk about some symbols, then the intersectionality of autism and queerness, coming out, challenges in society and healthcare, bias in research and diagnosis, gender and sexual expression, recommendations, and our resources.
Yes. So we have some vocabulary that we wanted to share with y'all before we get too into it. So the first one is the word allistic, or you might also hear autistic, and there's two spellings of that one. That just means somebody who does not have autism, who is non-autistic. Neurotypical is someone who has a brain structured in a way that's considered as typical, who does not have neurodivergence. Neurodivergent is someone who has a brain structured in a way that's not considered as typical. So to be clear, somebody may be allistic, but still be neurodivergent. You could have ADHD, but not have autism. So someone who is queer is not cis, heterosexual, or both. Person first versus identity first. So person first language is when you call somebody wait for it. So person first is when you say an autistic person, whereas identity first is saying an autistic person. And a lot of autistic people prefer identity first language, which would be to be called autistic. There was a survey of over 11,000 autistic folks, and that was the main preference. Yeah, it is still important to ask, but that is the general preference in the community. Tragedy porn is similar to the idea of inspiration porn, but it uses disabled bodies and experiences as a scare tactic to advance eugenicist agendas and policies. ASPI is a term used for and by people diagnosed with Asperger's syndrome. Asperger's is autism. It is a form of autism that is no longer really distinguished from the autism diagnosis. And functioning labels are labels used to describe how close to neurotypical an autistic person can pass. The autistic community views these as ableist and problematic.
All right, let's go a bit into our introduction. So a lot of you might have heard of Autism Awareness, April, Autism Awareness Month. We're now trying to transition from autism awareness to autism acceptance. And let's talk a bit about why we want to do that. Well, first of all, autism awareness was created mostly by non-autistic people and organizations. And whereas autism acceptance is created by mostly autistic people and organizations. Also, studies in the UK show that 99% of people are aware of autism. People know that it exists. Whereas only 16% of autistics think that society understands them. So what we really need to do is not just have people know that autism exists, but have people accept autistic people in the world so that we can function, fully and participate fully in society. Finally, autism awareness often centers the challenges or deficits or uses things like tragedy porn and focuses on normalcy or a cure to autism, whereas autism acceptance centers strengths, equity, disability justice, and the things that autistic people contribute to our society, and values autism as an identity and culture. One important quote is, "Awareness is worse than tolerance. Awareness is enough knowledge to weaponize, but not enough to empathize." So I hope that you all will join in helping to promote autism acceptance and maybe even autism appreciation in the future. Looking at the numbers, why is talking about LGBTQ identities in autism important? A lot more autistic people than allistic people identify as queer in some way. In fact, 15% of autistic adults identify as trans or non-binary by a study done in the Netherlands. In contrast, only 5% of the general population identifies as trans or non-binary. And secondly, 70% of autistic adults are not straight. And that's in comparison to 30% of neurotypical people who are not straight. So honestly, being queer and autistic is the majority, and it's something we really need to talk about. Why is there so much overlap? Well, one of the main reasons that autistic people like to share for why are there so many more queer people who are also autistic is that in general, autistic people might pay less attention to social norms, and maybe they're already kind of outside of the social category of normal or whatever. So it can be easier to continue to express yourself fully. And we have one quote here that says, "When I was little, I didn't think about gender at all. It was a category that had no meaning to me. I was just a person. Only when my body started to change when I was 12 did I suddenly come to the startling and awful realization that I had a gender. I hated it, and I certainly didn't want to be the one that my body was telling me I was going to have to be."
All right, so now we're going to talk a bit about the symbols that these communities use. All right, so these are some of the symbols used by the autistic and LGBT communities. So the first one that we have is a gold infinity symbol. We chose this because the color for autism is gold, because the elemental symbol of gold is AU, AU autism. Gold symbolizes the bright and shining future of autistic people, and it's also commonly used in the screen names for autistic advocates, as you may see in my screen name. The infinity sign specifically is used as well to show inclusivity, vastness, and oneness with the community. So the gold infinity sign is used for the autistic community, and as I said, so is the AU symbol specifically. Then the rainbow infinity sign is the sign for neurodiversity in general. So it's also an infinity sign, but this one is rainbow to represent the spectrum of different neurodivergent conditions. On the bottom left, we have my personal favorite, which is Autistic Cat. Autistic Cat is very cute. Some autistic people, such as myself, relate to cats in, we're very shy, we've got sensory sensitivity, and we express very hard boundaries that are sometimes difficult for people who are not autistic to understand. An autistic cat has a little heart-shaped tail and wears a little bow tie that is the rainbow infinity symbol. In the middle bottom, we have the autistic pride flag. So this flag is gold, and it does have a rainbow infinity symbol, but it's pastel for this flag. I'm not really sure why it's pastel, but I do like it. And then on the bottom right, we have the neurodiversity and queer pride flag. So this is a standard rainbow pride flag, but has the rainbow infinity symbol overlaid over top of the pride flag to show both being proud of your queer identity as well as your neurodiverse identity. So next we're going to have some symbols that we don't like. So these are symbols that have ableist history behind them. So the first one is the puzzle piece symbol, which you're going to see on literally all of these. The puzzle piece symbol was created in 1963 by the National Autistic Society. They thought that the autism was a puzzling condition, and originally they had this middle image with a child crying on the puzzle piece. This sent the idea that autism was a tragedy, and they put forward the idea that with autism, you are missing pieces of the person, hence the puzzle pieces. Autism Society adopted the puzzle piece ribbon in 1999. This is the one on the right, this very colorful one. They said that the brightness of the color of the ribbon signals hope. This is a quote, signals hope. Hope that through increased awareness of autism and through early intervention and access to appropriate services and supports, people with autism will lead full lives able to interact with the world on their own terms. And then on the left, we have the blue puzzle pieces. This was chosen by Autism Speaks in the very beginning because autism was seen as a voice condition. So they used blue for the idea of it being a male condition. Because autism has faced gender restrictive stereotypes for literally decades, there's still this pervasive idea that boys are more likely to have autism, when it's more so that they're more likely to be diagnosed. Autism was only studied in white cisgender boys, and the diagnostic criteria were developed in males, whereas females were more socialized and expected to mask their autistic traits. So here are 5 reasons why we don't like the puzzle piece, and Maddie is going to be reading a quote related to each reason after I explain each reason. So the first reason is that it's infantilizing. Autistic people are already so infantilized that many autistic adults are unable to access diagnosis, treatment, or support. The use of primary colors and the childish symbolism of the puzzle pieces doesn't help with this notion. You can find similar symbols used by preschools and daycares. Autism is often mistakenly viewed as a childhood disorder, but as it's the way that the brain is constructed, autism is lifelong.
The very childish puzzle pieces and primary colors are not helpful to combating the stereotype that we are perpetual children.
The second reason is advertising. So the puzzle piece is a logo that's used by many groups to advertise services that are viewed by many as problematic, and for groups where autistic voices are spoken over. In 2006, one such group even released an ad campaign where the organization's leader discussed wanting to kill herself and her autistic child. This discussion was spoken in front of the child, and the ad was seen by much of the public as being relatable and understandable. This ad ran on normal television. Even in modern times, there's still a focus on eugenics, and the murder of autistics by their caregivers are often characterized as mercy killings.
Continuing to ignore our wishes to use symbols which may remind us of our discrimination in society, or that people sometimes do kill us because of our autism, is disrespectful.
The next is aesthetics. So the design is actually very overstimulating, and many autistic folks have complained that it triggers their sensory processing disorders. Epilepsy is also a common comorbid condition with autism, and this design has been identified by some to trigger their seizures as well.
Visually, the bright, loud, jumbled primary colors are a hot mess of overstimulation.
The next reason is the symbolism. So historically, autism treatment has been directed towards finding a cure or preventing autistic people from even being born in the first place. And this is eugenics. Autism is a neurotype, it's not a disease. The symbol has also been chosen by organizations with the idea that autistic people are just neurotypicals who are missing some pieces, and that a cure would find the missing piece. But we are whole people whose brains are wired differently, but not broken neurotypicals.
The puzzle has historically meant the final genetic link to a cure. We can't move past that.
And our final reason is that it's a red flag. The puzzle piece symbolism is viewed as a red flag to many autistic individuals. Autistic advocates have spent over a decade advocating against these harmful ideas and the symbolism that's attached to it. To many of us, the puzzle piece symbolism is an immediate red flag that tells us that our voices aren't going to matter to that organization. And we have a little graphic on the side of this slide, which is Autistic Cat. It's a different version of Autistic Cat, but it says Autistic Cat kills puzzle pieces and has a red autistic cat munching on some blue puzzle pieces. Pretty sure I have that on a pin. Okay, so what if you've been using the puzzle piece? The way to respond in this situation is actually really similar to how you should respond if you've been accidentally misgendering a trans person. So what you do want to do is you want to acknowledge the harm that has occurred, and you want to correct yourself and strive to do better. It's important to practice. But what you don't want to do is start, explaining what your good intentions are, or take this as a personal insult, or especially continuing to do it. We know that you meant well, and we do understand, but we need to be able to control our own narratives. And then one of the hashtags we like to use for autism advocacy is this one. It is hashtag nothing about us without us. This means that we should be involved in all conversations about what is best for autistic people and what symbolism and advocacy we would like for our community.
All right, now we'll talk a bit more about intersectionality of autism and queerness. A lot of pride movements are actually rooted in the Black Power and Black Pride movements during the Civil Rights time. That was around the 1960s. Then queer pride emerged around 1969 and moving forwards, in 1969 with the Stonewall. And finally, or next, disability pride started in 1990 when the Americans with Disabilities Act was passed. And later in 2005, Aspies for Freedom holds the first Autistic Pride Day, which is on June 18th. Autistic and queer pride share that all people deserve to feel proud of their identities. And pride is practiced most of the time, not during a specific month or in the streets or in a parade, but actually every day by people daring to express themselves and be who they are. And it's something that we should respect and uplift in our communities.
Okay, so we're going to talk about spectrums real quick. So autism, just like gender and sexuality, is a spectrum. Autism doesn't range from less autistic to more autistic, and gender doesn't range from male to female. Autism is a different neurotype. Again, it's not a broken neurotypical, and autism can look many different ways because it's a spectrum. An autistic person may be non-speaking but have strong fine motor skills. Another may be speaking but have high sensory needs and poor motor skills. We're all unique in our strengths and our challenges. Similarly, non-binary people are not woman light or man light. Non-binary people are not broken cis people or broken binary trans people. They are an entirely separate gender. Gender is also a spectrum, and each individual person may sit anywhere within or even outside of the typical male-female spectrum. Some people do not experience gender at all. And now we're going to talk real quick about something that's I think is really cool. It's called neurogenders. So this is actually a cool thing specifically within the neurodivergent and queer community. So neurogender is an identity where your gender is linked to your neurotype, and it includes a lot of subgenders, including gender vague and autogender. Gender vague was described by autistic self-advocate Lydia X.C. Brown as, quote unquote, a term coined within the autistic community to refer to a specifically neurodivergent experience of trans or gender identity. So autogender is an identity where your gender is so influenced by autism that it cannot be understood without thinking about autism. And neuroquidity regards to gender identity, sexual identity, and sexual orientation and sexual attraction that are all rooted in, shaped by, or are deeply part of one's neurodiversity. Now, it's important to understand that neurodivergence doesn't cause these gender identities, and not everyone who's neurodivergent will have one of these identities. Lydia X.C. Brown stated that, quote unquote, for many of us, gender mostly impacts our lives when projected onto us through other people's assumptions, but holds little intrinsic meaning. Someone who is gender vague cannot separate their gender identity from their neurodivergence. Being autistic doesn't cause my gender identity, but it is inextricably related to how I understand and experience gender. And we have some of the flags on this slide. So the first one is the neurogender flag. So it has 4 stripes, a red, kind of an olive green, a light blue, and a purple stripe with a black infinity symbol overlaid over it. In the middle, we have the gender vague flag, which is a black stripe on the top and bottom, and then a gray box as the inside of the flag. And then autogender is a pastel version of the pride flag that is also flipped upside down, so the purple is on top. And then in the middle, we have a pink circle that has a darker pink infinity sign with a little dark pink heart above it. Okay, so to continue talking about disability and queer identity, it's important to separate and recognize the LGBTQ plus identity of asexuality versus the desexualizing stereotypes that are often faced by the disabled community. So autistic people are more likely to identify as asexual. In one study, 10% of autistic adults identified as asexual in comparison to 1.5% of allistic adults. Asexuality is an LGBTQ plus identity, and it should be honored when somebody self-identifies that way. However, disabled and autistic people have faced strong and false stereotypes of desexualization that have caused harm to the community and prevented them from relationships, sex education, and pleasure. The fact is that the overwhelming majority of autistic adults are sexually active. 70 to 76% of autistic adults are sexually active. Even for those who are asexual, being asexual doesn't always mean a lack of romantic interest. This means that it's incredibly important to dispel the stereotype that autistic people are not interested in sex, while also recognizing the higher rates of all queer identities in autistic people, including asexuality, and providing sexual education and support accordingly. Okay, so now we're going to talk about something else that's fun. So this is a fun little side note. So you may be familiar with the term gaydar. This is a term for gay people being able to spot other gay people in public based off of lesser known mannerisms and cultural references from the gay community. Autistic people actually have this too. We haven't really named it yet because autdar is kind of hard to say. But a lot of the time we can pick up on the smaller mannerisms or speech patterns that help us to spot other autistic folks. It is important, though, to never assume anyone's identity. And if you suspect that your friend may be autistic or queer, if they're not out as such, you should never try and label their identity for them. So now we're going to move on and talk a bit about coming out. So first and foremost, we want you to know that coming out is your own individualized journey. So it's okay to never come out or just, delay coming out. It's okay to only come out to yourself or to a few people. It's okay to self-diagnose and self-label. It's okay to come out multiple times. It's okay to change your label, and it's okay to change your mind. You're in charge of your own identity. Any step towards being your true self takes bravery and should be celebrated. So queer people and autistic people actually face a lot of similar challenges with coming out. So this can include the fear of discrimination, targeting, and bullying, the fear for autonomy being taken away, the fear of dehumanization and losing your rights, the fear of being discredited, the constant feeling like you need to prove yourself, having to deal with passing, and the risk of victimization. So everyone has to balance these risks and the benefits of coming out in their own way. Please remember that for both queer and autistic people, coming out should always be done by the individual themselves in their own time, not by anyone else talking for them. And so now we're going to talk about passing versus masking. So when people are not out about their disability, or sexuality, or gender, they might engage in passing or masking. So passing is being perceived by onlookers as cis, heterosexual, and or other stereotypical normative identities. Masking is changing or hiding your behaviors and traits to be perceived by onlookers as neurotypical and or non-disabled. So trans people are expected to pass, and autistic people are trained to pass. Conversion therapy is still alive and well today. Coming out can be a large risk to the individual, as it risks being forced into this therapy despite the harm that it will cause. There are also gendered expectations for masking, where AFAB people or assigned female at birth people are expected to mask more. It's important to know about these terms to understand the experiences of our community. So now that we know what they are, we ask the question, to pass or not to pass? So passing is frequently a societal expectation of both queer and autistic people. Failure to pass is often punished, which means that passing and compliance may be necessary for safety or comfort. Autistic masking has been shown to have negative health impacts, including stress, anxiety, depression, suicidal thoughts, exhaustion, and autistic burnout, loss of identity, etc. While coming out as queer in itself may not always improve mental health, being able to live openly as queer in a supportive community can promote positive physical and mental health. What we should learn from this is it's okay if you can't always be yourself in public, and if your safety needs to come first. However, being able to live authentically is protective to people's health, and it's one of the most important supports that we can provide to the autistic and queer communities. Now we will be moving on to talk about challenges in society and healthcare. There will be brief mentions of statistics related to self-harm and suicide, police violence, hate crimes, etc. So we encourage folks to take care of themselves however they need at this time. Feel free to mute your device, grab a fidget toy or a pet, or step away if you need to. The content warning for these slides will end at, we have it at slide 52, but these are not going to be numbered in the video. So I guess when we post a video, we can put a timestamp. Right, so one risk for coming out is the fear of being discredited. For both groups, other people will often accuse you of faking it for attention or for the views, not being queer or autistic enough to identify with the label. Some people will make assumptions like, if you don't have a certain autistic trait or if you're not nonverbal, then you can't be autistic. If you don't conform to the stereotypes that are being forced on you, others will take it upon themselves to accuse you of faking it. Because of this, there's this constant need to prove yourself, and it can be extremely emotionally draining. Autistic people are often told that they can only prove themselves by publicly disclosing their diagnostic paperwork. Queer people may be forced to overcompensate to prove that they're really queer. This can include having to prove that you need support, having to prove that you can make your own decisions, sometimes having to overcompensate or undercompensate, having doctors approach it as a tragedy, thinking that you'll be overjoyed if they decide that you and your other doctors were wrong, that you're normal and you just have anxiety. I experienced this personally as a non-binary trans person. I had to hypermasculinize myself throughout my transition. I was dousing myself in Axe because if I wasn't aggressively masculine, doctors and therapists would sometimes treat me like I wasn't really queer. At one point, I was told directly by a psychiatric nurse practitioner that she wouldn't write me a letter that I needed for my insurance to cover my hysterectomy because I probably wasn't even trans. Another risk of coming out is the fear for autonomy being taken away. Especially for younger folks, there's a fear of losing autonomy associated with coming out. Coming out as autistic could mean that your interests and your preferences start to be disregarded and pathologized, and your voice is ignored. Coming out as queer could mean being forced to dress and behave in a way that's associated with your sex at birth, and be disallowed from wearing anything that isn't extremely binary. There's also the fear of dehumanization and losing your rights. In the US, conversion therapy for both autism and queerness exists and is legal. Coming out can mean being forced into conversion therapy and could even include losing rights such as the right to consent or refuse medical treatment. There are still cases today where doctors will treat queer people as delusional and psychotic and will treat them by TDOing them, taking them off of their medications, and forcing them to behave as the sex they were assigned at birth. Autistic people are often denied the right to consent to medical treatment. There was this whole scandal during COVID in the UK where doctors were submitting DNRs for autistic patients without their consent or knowledge of the patients or the caregivers. This loss of autonomy is also related to everyday life decisions. One study found that only 17% of autistic adults between the age of 21 and 25 have been able to live independently, compared to 34% of non-autistic 21 to 25-year-olds with intellectual disabilities. One of the more famous versions of this loss of autonomy and loss of rights that has been in the recent media has been the Britney Spears conservatorship. She had her rights and her privacy just completely stripped from her for years. And that isn't always necessary, and it can be terrifying and controlling. Another danger facing our community is the fear for discrimination, targeting, and bullying. There's a heightened risk for victimization for queer autistics. For both groups, coming out can be being targeted and ridiculed by your peers. It can mean facing discrimination, especially in schools and the workplace. Both queer and autistic people are more likely to experience bullying, and in fact, 73% of gender diverse autistic youth experienced bullying in one study, poll, survey, whatever this was. Another risk is victimization. The highest risks of coming out are that the person may become a target for hate crimes or even being killed. 440 queer people were victims of hate crime in 2020. And people with disabilities are 4 times more likely to be victims of violent crime. And autistic children specifically make up half of the filicides of disabled children. It's important to show here that all of these risks increase even more for communities of color. Black students experience disproportionate bullying and victimization, and 61% of hate crimes in 2020 were racially motivated.
All right, another important risk for queer and autistic people is misconduct by police. Queer and autistic people are more likely to experience apprehension and violence by police, and these risks increase even more for communities of color. For example, LGBTQ people are 6 times more likely to be stopped by police. 1 in 5 autistic people will be stopped by police by age 21. Black people are 5 times more likely to be unfairly stopped by police. Disabled and autistic people are more likely to experience police violence and to be killed by police. Trans people are 3.7 times more likely to experience police violence, and trans people of color are 6 times more likely to experience police violence. 1 in 5 people killed by police has a mental illness or mental health condition. And Black people are 2 times more likely to be killed by police than white people. So it is an extremely important issue in our community that is supported by the data. Another source of inequality is through social inequalities and discrimination. Both autistic people and queer people are more likely to experience social inequalities such as homelessness, living without independence, unemployment, discrimination, housing and food insecurity, disenfranchisement, sexual abuse, low income status, lack of education or dropping out of school, social isolation, lower marriage rates, and lack of service provision. For example, 40% of homeless youth identify as LGBTQ, and 40% of people with disabilities are also homeless. And all of these factors are disproportionately impact communities of color. For example, youth who are Black and LGBTQ reported the highest rates of homelessness. Another issue is health inequalities. Queer autistics compared to straight and cisgender autistic people have significantly higher rates of poor health, including mental health, physical health, and factors that can affect your health, like smoking. They also have worse healthcare access in terms of unmet healthcare needs, inadequate insurance coverage, and refusal to be treated by doctors. And again, each of these factors are disproportionately influenced for people of color. And you can see in the graphic on this slide that measures depression in autistic and non-autistic people who are trans or cis. Trans autistic people have the highest rates of depression, and in general, autistic people have higher rates of depression than non-autistic people. There are multiple factors that lead to healthcare inaccess in queer and autistic communities, and some of which include fear of not being taken seriously, lack of affordability in transportation, fear of identity being misunderstood, and fear of being outed. People of color are at particular risk by healthcare providers not understanding their culture or identity. History of abuses in reproductive and general medical and research practices have produced justified doubts about whether the healthcare field can truly care for marginalized communities. Some of these events have included forced sterilization of people with disabilities and BIPOC people, especially Black and Indigenous people, as well as abusive experimentation of reproductive health care in communities of color, and the eugenic design of family planning, the pathologization of LGBTQ plus identities in the DSM as well. So it is up to the healthcare field and governmental leaders of these efforts to demonstrate the needed steps to rectify these injustices and to show that they can be trusted with the healthcare of our whole population. One other inequality in autistic and queer people is the risk of suicide. Autistic people are 3 times more likely to attempt suicide, and there's an elevated risk in women identifying autistics and even higher in autistic trans women. It's also 4 times more likely in LGBTQ people. For example, 12% of white youth who are queer attempted suicide in the past year, whereas those numbers are 21% for Native and Indigenous youth, 17% for multiracial youth, 16% for Latinx youth, 20% for Middle Eastern and Northern African youth, 19% for Black youth, and 12% for Asian American and Pacific Islander. There's a huge host of risk factors for suicide. A lot of them in general are ones that promote supported living and free expression of identities. For example, factors that can factors that increase risk are ones that reduce ability to express oneself freely and be supported in living in the community. For example, stigma, violence and bullying, minority stress, conversion therapy, lacking the supports that are needed, inaccessibility, masking, unemployment, gender dysphoria, and multiple other issues. On the other hand, protective factors include factors that support people to express and live as they are in the community with the resources and support that they need. For example, respecting people's pronouns, satisfaction with your living arrangements, having autonomy, employment, meeting your support needs and accommodations, social support, legal document gender changes, affirming medical care, mental health care access, and multiple other factors. Finally, we want to cover some ways to improve accessibility for the autistic and queer community. And through that, we want to talk about bias in autism research and diagnosis.
Also, I'm just going to mention that my camera froze, so I have turned off my video for now while I try to fix it.
Okay. Autism and LGBTQ have a shared history within medicine in some aspects. Both historically have been viewed as pathological and non-normative behavior. Another important fact is that applied behavioral analysis was invented by Ivar Lovaas in the 1970s. This is currently regarded as the leading treatment for autism. However, Ivar Lovaas had a pretty dehumanizing view of autism and said quotes, for example, this one where he said, "You see, you pretty much start with scratch when you work with an autistic child. You have a person in the physical sense, they have hair, a nose, and a mouth, but they're not people in the psychological sense." That was one of the beliefs of Ivar Lovaas, who created this therapy, ABA interventions that he used, and even included repetitive trials and punishments and slapping or electric shocks, which are still sometimes used today in certain institutions or facilities, not all of them. At the same time that Lovaas created ABA, he was also working on something called the Feminine Boy Project, where he used similar techniques as what he used in ABA to develop queer conversion therapy. He was not the only creator of conversion therapy for gay people, but was a contributor, and he taught Reverend Dr. George Reckers, who has gone on to be a major proponent of gay conversion therapy. So it's really important that we notice this theme throughout history and medicine to pathologize autism and queerness and to try to extinguish these behaviors that could make someone appear abnormal, quote unquote, and paint them as things that are bad. Another important impact in medicine and research is that autism was first studied in white men, and that skews diagnosis and treatment towards white men. And even today, white male and upper class people continue to be overrepresented in research. For example, 4 to 6 males are included for every female in autism research studies. But why is this so important? Autism characteristics can differ based on gender. That has been shown in multiple studies, and people who are assigned female at birth are often more socialized to mask their autistic traits, so it can be harder to detect in these cases. One hypothesis that's been created and perhaps influenced by the overrepresentation of male people with autism in research is something called the extreme male brain hypothesis. This is the idea that autistic people tend more towards systematizing or recognizing patterns, which are things that society sometimes deems as male, and that autistic people are less inclined towards social skills and empathy, which are society sometimes deems as female. This was proposed in 2002 by Baron Cohen. It's problematic, not only because it's been disproven by various studies and autistic voices themselves, but also because placing gender restraints on traits that should not be gendered, and it narrows our view of what autism looks like. Some people have linked prenatal sex hormone exposure with autism and being queer, which can also be dangerous to overemphasize biological factors when it comes to pathologizing both autism and queerness and gender expression. Additionally, many studies have shown that prenatal hormones might not cause autism or queerness, so we should not be taking all of these studies as 100% fact. And in truth, gender diversity and a number of autistic traits are not different in people who are assigned male or assigned female at birth, who are queer. And autistic people do have empathy. In fact, there's lots of studies that show that some autistic people might even have hyper empathy in some types, like affective empathy. And also, after adjusting for sex bias in diagnosis, some studies show that roughly the same percentage of males and females are autistic. So this is not a boy's condition, as was believed in the past, but has just been influenced by decades of gender bias, where some studies suggest that if we got rid of that gender bias, there might be the same number of males and females who are autistic in diagnosis. What are some impacts of this bias? Well, autism now is underdiagnosed and undersupported in people who are assigned female at birth, and as well as trans feminine people. Clinical tools have been shown to be gender biased. It also places limitations on gender expression, so how autistic people feel like they can act and behave. Trans autistic people are now often afraid of their impacts of being trans on their diagnosis or vice versa. And it also leads to a potential discrediting of being queer as a identity, but dismissing it as a symptom or trait of autism, and therefore not being valid for some reason. Another important impact based on the exclusion of people of color from research in autism is that people of color are consistently historically underdiagnosed, and autistic traits in Black people are misinterpreted more often as aggression or intentional misbehavior. And these communities have far less access to autism services and supports. Finally, let's talk about gender and sexual expression. Health professionals and caregivers might refuse to provide gender affirming care to autistic individuals because, as you mentioned previously, they might believe that being queer is due to their autism and that somehow makes it invalid, or they might believe that autistic people are incompetent, so they're not able to self-determine what their gender identity is. And in fact, 35.7% of LGBTQ autistics have reported being refused services at some point by a medical provider. And that is compared to 20% of straight cisgender autistic people. Another issue is failure to provide relevant health information. That could be due to viewing autistic people as infantilizing, so thinking of them as children perpetually, or placing heteronormative stereotypes on them, so not providing the right sexual health information. If somebody is gay or bi, they need that information about those types of sexual relationships as well. Insurance also doesn't provide a huge amount of options. Medicaid's now mandated to cover trans-related surgery and hormones, but 30 states allow for insurance companies to deny trans-related care. And there's also barriers in documentation and having to prove that you need this gender affirming care. One really powerful quote from an autistic queer individual is this: "If I'm just a queer disabled person and I'm just going to my regular provider, not only are they going to assume that I'm not having sex, but they're also not going to provide any accurate information there." So this is a real place that we can grow in our healthcare. Another important thing to note is that gender dysphoria can show up as a mental health issue and be dismissed as autism symptoms, when really just treating the gender dysphoria could greatly improve the person's mental health and thus reduce their meltdowns. For example, this is one case study where after several months of gender affirming treatment and accepting a child's gender identity, they went from having multiple frequent meltdowns and limited communication to being able to communicate much more effectively with their family and having a lot more self-confidence and less meltdowns. Another important thing for being queer and autistic is that some parts of being autistic can make it harder to figure out gender and sexuality, and social stressors also can particularly impact autistic people. So that means that we really need to be providing support to autistic people and how they can discover what their gender or sexuality may be. One quote says, "Having ASD really does complicate things when it comes to identity. On a logical level, I know I've never felt attracted to men, but since it's very difficult to identify sexual and romantic feelings in myself, I can never be quite sure what my native sexual and gender identity would be if I didn't have the difficulties of autism." Another person said, "If you ask if I feel like a man, I don't know the answer, and the future scares me of not knowing to identify. From my autism, I tend to keep thinking about all the possible outcomes. My thoughts keep going until I get it throbbing in my head. Thinking about my gender identity is also a part of this. I can't just find a clear answer." So these quotes just show some ways that we really could provide more support to autistic people in discovering and expressing their gender and sexuality. And this just shows that we need more sexual education for this group. And while this does not represent every autistic person in the world, they are some important things to consider. There's also multiple social barriers to sexual and gender expression in autistic people. In fact, 32% of autistic and trans teens report having their identity questioned because of their autism. So people will say, oh, because you're autistic, that means you don't know that you're trans or you can't be trans. So it can be difficult to feel understood if you're an autistic and queer person. Having a multiple minority identity can mean you could be ostracized by multiple identity-focused communities. You could be ostracized from the queer community because you're autistic, or from the autistic community because you're queer in some spaces, although we know the majority of autistic people are queer. Failure of others to take your queer identity seriously because of autism. And gatekeeping can happen both by providers and health professionals, as well as communities themselves, and can lead to things like isolation, misunderstanding, discrimination, and other things.
So a lot of autistic folks also have sensory issues, and sensory issues can pose certain challenges for gender expression. For example, the feeling of having a period could cause sensory issues and heightened dysphoria. Sensory sensitivity can cause hyper-awareness of one's genitals, and sensory issues could also cause problems in sexual relationships. For example, making someone hyper-aware of certain areas of their body being touched that makes them feel dysphoria. Many tools for transgender expression can also trigger sensory issues, which brings the need to be creative in finding ways for adaptive gender expression. For example, binders can be too constricting. Packers could provide constant sensory input that's unwanted. Body hair and shaving could pose unpleasant sensory experiences, and gender-affirming surgery can pose sensory and anxiety issues. Some providers are unwilling to provide sensory accommodations, which prevents people from finding creative ways to express their gender that suits their bodies. Transition goals can be related to sensory goals, and individuals should have open conversations with their care providers about how to suit their needs. For example, one could decide not to go on tea because it could cause body hair growth that would trigger sensory issues. In my own experience, my sensory processing differences meant altering the way that my transition looked and has directly impacted the way that I present. I decided not to go on testosterone, both because body hair and shaving would be an issue for me, and because I mainly stim with my voice. I didn't want changes to my vocal cords to change the way that I stim or the way that it feels. I've had to work closely with my doctors, as getting a full hysterectomy without going on T presents its own set of medical challenges. But finding doctors who would listen to me and to my needs has helped me to transition fully to a body that feels safe to me. My top surgeon was also able to take my needs into account for my surgery. The sight of my own blood can make me extremely nauseous and anxious and can cause me to faint. Top surgeons use a device called a drain on either side to collect extra fluid and blood post-op to help prevent swelling and keep track of the healing process. I came up with a solution where I cut open the back of 2 stuffed bears and I sewed a pocket into the back of each using measurements of the drain provided by my surgeon. I even sewed them little top surgery scars with some red glittery yarn so we'd match when I woke up. I brought them to the hospital with me, and the nurses put the drains into the bears before I woke up from surgery so I wouldn't have to see them. Stuffed animals are one of my main comfort items, so being able to use them to help keep my anxiety down post-op is really helpful for me. All right, so let's talk about autism and disability affirming gender gear. There's a lot of options for autism and disability affirming gender gear out there. You just kind of have to look for it. On the top left, we have a pair of tucking underwear by Rebirth Garments, which can be a more sensory-friendly or comfortable option compared to other tucking methods. Those Rebirth Garments is really special because they're specially trained indoor garment design for people with disabilities, but they can be a bit expensive. In the top middle, we have a cloth packer, which can be more sensory-friendly than the silicone packers, which are a slightly harder material. On the top right, we have sensory-friendly chest binders by Amore Binders, which is an amazing brand that was founded by a trans autistic person. They make gear specifically for our community. On the bottom left, we have period underwear by Thinks, but you can also get them from other brands. Period underwear can be more gender affirming or sensory friendly than other period options, such as pads or tampons. On the bottom center, we have trans tape, which can be a less constricting alternative than a binder, but will still provide a flat-chested look. Finally, on the bottom right, we have breast forms and a pocket bra, which has pockets for the breast forms, so they don't have to have that silicone right up against your skin. These are from the Trans Tool Shed, which has a large variety of gender gear at more affordable options. We will have a more complete list of gender gear resources at the end of this presentation. So let's talk about Pride. Specifically, how to make Pride more accessible to autistic people, because as previously stated, a lot of us go to Pride. So having alternatives to the very loud, crowded Pride events would be helpful. Pride tends to be completely packed full of people. It tends to be loud. There's a lot of smells. It's a lot. So having venues that have lower volumes and don't have flashing lights, especially since epilepsy is a common comorbid condition. Having silent discos where the headphones have volume controls. So you can control if you want to hear the music at all, and you can control how loud the music is. Having specific areas designated for vendors who have scented products and foods. So you're not just bombarded by all of these smells. Having it wheelchair accessible, because again, many of us have comorbid conditions, and some of those do require the use of a wheelchair. Having ASL interpreters at all shows anywhere that announcements are being made. So not just for the shows, but anytime they're doing any kind of announcing, any contests, anything, there should be interpreters. Having large signs placed around the venue with the schedule of events and the locations, as well as a map of the venue areas. It would also be helpful if the Pride has if they have a website, having that on the site would help as well. Having sensory rooms, which are rooms that have low lighting and noise, and they usually have access to STEM toys, a safe, calm place where autistic attendees can go to get away from all of the noise, the smells, the people, and gives their sensory processors and their brain a break. And we have some images on this slide. So let's see. So our top left is actually this ASL interpreter who went super viral. His name is David Cohen. He was at Pride 2019. We have a little autistic cat, but he's wearing little rainbow headphones. We have on the bottom left, we have a picture of what a silent disco can look like. And on the bottom right, we have the members of the Arc of San Francisco. They went to the Pride event together. They organized, all went as a group, which I think was really sweet. And it's fun to go to Pride with your friends.
All right. So we've gone through a huge amount of information, but let's follow up with some general recommendations. What should we do? We should listen to autistic and queer voices, particularly those that have been the most marginalized, and we should hire and collaborate with people from these identities. We need to promote more autistic and queer voices into positions of power in actions regarding these groups. We should not just be consultants on the side. We should have ownership of what is happening in any sort of event or effort that is directed towards queer or autistic people that, groups that concern that population. We need to include accurate sexual education specific to queer relationships, sexuality, and issues for queer people. We also need to provide autistic people and families with contact info about LGBTQ resources and social groups. pay attention to gender stress and dysphoria within queer people, within autistic people, and actively seek accessibility and inclusivity in the spaces we inhabit. What else should we do? Honor self-identification and expression, be that disability, support needs, sexuality, gender, or any other identity. For example, if somebody says that they are a man, but they also like Hello Kitty and the color pink, we should still believe that that person's a man. We should believe what they said. We should be willing to openly talk about inequities, racism, ableism, homophobia, and transphobia. We need to visibly acknowledge and discredit stereotypes so that they will not be continued. And many people will not hear what is not stated out loud. We need to be flexible and open to change based on people's expressed needs. Some people have needs one day based on their disability that change over time, and we should be flexible to help accommodate these people as their needs change. We should practice humility in culture and identity, and expand our personal and organizational views of what LGBTQ or autistic people look like. For example, we should not think that autistic people only look like white men. We should expand our view to include queer people and women and all races and ethnicities and cultures. We need to honor the inherent value of all bodies and seek to show others that they are valid and worthy of care, relationships, and pleasure. It means we need to empower people. And finally, we need to practice continuous self-awareness about the power that we hold and the prejudices that we contain in our relationships with others, so that we are continuously improving ourselves and learning from others, as well as we teach others things as well. Thank you so much for listening and for paying attention. And I hope that you have taken something away from this presentation. I'd like to highlight that we have a very large list of resources available. They are in research, in organizational and professional assessment, support pages about autism and queerness specifically, books about queerness and autism, some art efforts, and here we have the list of links for autism and disability affirming gender and sexuality products, racial justice in sex ed, BIPOC-led organizations. Here we have a list of online activists and organizations that you can follow, as well on this slide. And we will have the link to their slides in the chat or description so that people can find those links. Thank you so much.